Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, some of the highlights. Today, Nigeria Medical Association, Lagos State, reverses sit-at-home order amidst the COVID-19 battle. On our theme, we focus on the enforcement of travel ban across the country as a result of the coronavirus. SARS-CoV-2 surpasses 5 million cases globally. That's according to the Johns Hopkins University. One of the ways the federal government thought it could flatten the curve of COVID-19 is through travel restrictions, and this includes interstate travel. Recently, however, reports have filtered in that the restriction order is not achieving its objectives. The security personnel have been accused of compromise and allowing free passage while people are caught smuggling people themselves in at night. Well, the government has again, at the lapse of the lockdown, is redirected for strict compliance, threatening to sanction anyone caught flouting the rules. On our theme this afternoon, we analyze how best authorities can ensure restriction orders are obeyed and, of course, trying to stop the spread of COVID-19. The death toll from COVID-19 in Nigeria has risen to more figures are coming in, talking about 200 now. This is after yesterday's number. Now, according to the latest figures released by the NCDC, Nigeria Center for Disease Control, which also announced 284 new infections of the virus, bringing the total number of positive cases in the country to 6,677. Well, 1,840 persons have been discharged across the country. Now, the new infections were in 12 states and the Federal Capital Territory, with Lagos having the largest number of 199 cases, Rivers State 26, Oyo 19, the FCT and Borno 8 each, Plateau 7, Jigawa 6, Kano 5, Abia 2, and 1 each in Ekiti, Delta, Kwara, and Taraba states. Let's bring you a breakdown of the figures by region, showing Lagos in the southwest still maintaining the highest number of cases, followed by Kano in the northwest. Over in the north-central region, you have the Federal Capital Territory as the third highest with 435. Borno still tops in the northeast with 235. Edo leads in the south-south, but cases remain at 119, while Enugu in the southeast unchanged at 16 cases. So what would have been day one of the Lagos doctors sit-at-home order has now been reversed by the Nigerian Medical Association Lagos State chapter. The decision was taken today after a meeting with executives of the association and also after clarifications we hear from the Nigerian police force, who gave the assurance of cooperation with all health workers. Furthermore, the NMA Lagos also received guarantees from the governor of the state, Mr. Babajide Sanwo-Olu, that no health worker will be further harassed in the course of their lawful efforts to sustain services in the middle of the pandemic. The doctors had earlier told their members to sit at home due to what they called incessant harassment of health workers in Lagos State. Well, for more on this, we have Dr. Shalom Oni. He is a member of the NMA in Lagos State, also a public health physician. We'd like to welcome you to the program.
Thank you very much, Millicent.
So it's great news to Lagos residents, especially in the middle of COVID-19, that the doctors now can resume work. But what were the experiences, the allegations of harassment before now?
Well, Millicent, the last thing you want to see as a doctor is returning back from work and you barge into a queue and finding out what is going on, you discover that the curfew has caught up with you and you cannot move. Now, currently, all health workers are stressed up. So to come and meet a situation during transit that could have been resolved if the coordinated response on COVID-19 is really working. It's sad. Now, let me say something here. Just that 24-hour miscommunication, between the government and, and the health workers, those who are also, and also those who are carrying out the activities, at the blocking the stations. There has been loss of lives, especially those who are non-COVID related. So we can't afford this, to reoccur again. For me, I think the government has, come forward to give a release and reverse. But I believe NMA also gives certain terms. And I don't know whether those terms have been complied with. But I know that NMA will go back, look at what the police have been able to say, their release, analyze it. If they are satisfied, yes, they will give their own release. If they are not, honestly, the sit at home may just continue because nobody wants to experience this kind of thing anymore.
It's very sad that we're hearing that a number of people could have lost their lives in this 24 hours.
Yes.
With what you're saying.
There were cases of ambulance being turned back that night, that unfaithful night, ambulance turned back. Imagine patients who were already in an emergency situation. So this cannot afford to, happen again. And I believe that the coordinated response that also involve all agencies, they have to put their hearts together.
Well, that's also another question, because they're giving the reassurance, and this is from the police, that essential health workers and other services indeed are not part of that curfew and they should be allowed through. But the thing is, in actual fact, how do you enforce this, or how do you hope that when you close it, and it's 8 p.m. wherever you are, that you will be protected and allowed to pass?
All right. It is in two ways. Number one, it's one thing for the Commissioner of Police to say something. It's another thing for the people who are at the station to actually effect it to the letter. So that has to be resolved between the Commissioner of Police and all his men that are on the field. On the other hand, for the health workers, I will advise that every health worker should continue to move around with means of identification. Your ID card, a letter from your office showing that you are one of the COVID-19 responder, you are an essential service provider, and things like that. And not argue with, with the police personnel, that are on the streets. So for me, and there should be helplines here and there where you can quickly make a call so that, individuals who are stranded, on the streets, can be rescued. So these are things I believe, has to come into play before we can say, yes, this issue won't resolve anymore.
All right, let's move over to, indeed, ways we can stop the COVID-19 pandemic. We're seeing more community transmission in densely populated areas. How would you say we're managing things?
Well, it is sad that we are in the 100% community transmission, because this is a stage that you don't want to get into. After missing the initial window of shutting down flights early, around that early March, to the place of doing something critical during the first phase of the lockdown. Because what the lockdown was actually meant to solve was to ensure that you are aggressive in testing, aggressive in releasing results, aggressive in evacuating positive people out into isolation centers, and making sure that infection prevention protocols, are solid, in all the facilities. But now that we have missed the first window, second window, and now we are at the full community transmission. Number one, the health workers, they need to be protected now because COVID cases, non-COVID cases will be flooding the hospitals, the private and government. We talk about government, talking about the teaching hospitals, we're talking about the general hospitals, we're talking about the primary centers. So all health workers, at those levels must be fully protected. I've had colleagues, some individuals arguing that, well, certain individuals don't need to be on full PPEs. But for me, I disagree. Because there have been instances of medical record officers, accountants, pharmacists also becoming COVID positive. So everyone working at that level must be protected. That's one. Two, the issue of lockdown, stroke, economy, it has been, an ongoing battle. Personally, I think, the lockdown should still continue. However,
partial or total?
For me, total. Because you don't want to get to a situation whereby you have the UK experience, the Brazil experience, the United States experience. How are you going to explain it when you're having 20,000 deaths, 16,000 deaths? These are not just mere statistics. These are human beings, for God's sake.
Let's quickly go to Imo State. I believe we have one of the member of the Imo State COVID-19 Task Force and chairman of the Enforcement Committee with regards to what's happening around the borders there. He joins us via Skype. Thank you so much, Dr. Donga Excel. Good to have you on the program. Tell us about enforcement around Imo State borders.
Can you hear me? Hello.
Go right ahead.
Okay, Imo State, being a state that has peculiarities, what do I mean? It's not as densely populated as Lagos. As chairman of the Enforcement Committee, we have been doing our best, ensuring that our borders are not porous. We have engaged the security operatives and we do border patrol periodically. And the governor has given an order that people should bury their dead within 2 weeks. And the dead we're talking about are those who died in Imo State. We're not asking people to bring in corpses from endemic areas or epicenters like Lagos State and all that. So when we were on patrol last week, we made sure that nobody brought in corpses. It's part of our protocol to ensure that our people are safe. As I speak at the moment, we don't have any confirmed case of COVID-19 in Imo State at the moment. So Imo State is considered to be free at the moment.
All right, Mr. Excel, what perhaps do security agencies know what to do when they see a suspected COVID-19 case around the borders?
Of course, the people that are there are not just security operatives, as the case may be. We have health care workers too. They have their high-health infrared thermometer checking temperatures and also ensuring that people that are coming in properly sanitized by using hand sanitizers and also having hand wash stations put in place at the borders.
Looking at the other checks and measures to ensure the interstate travel ban is not broken, what do you do when you still see people flouting the rules?
Of course, people are very difficult to manage. No matter what you do, you must keep on trying. Some people try to violate the others. They stop at some points and pass through bush paths to come into the town or the state. But when we find such persons and they are human beings, most of them are Imolites, they are our own, we won't ask them to go back if they are in place. But like I said, we do some periodic checks on the assessment checks based on temperature rise and sanitizing and coming in.
All right, we'd like to appreciate your time. Thank you so much, Mr. Donga Excel, the head chairman of the Enforcement Committee, also a member of the Imo State COVID-19 Task Force. Dr. Donga, thank you. Thank you so much for joining us. Just before we go on a break, and this is with regards to the COVID-19 response in terms of, would you say that we're under budgeting? I know we definitely need more funds, but with regards to managing the cases.
For me, it looks like, well, there might be an under budgeting. 2, efficient utilization of what has been budgeted. Because if we are not under budgeting and there's an inefficient utilization of funds, it will still look as if you under budgeted. So, but overall, looking at what is going on right now from the state to the local government and to the community level, there are a lot of gaps. Number 1, PPEs are not adequate. Number 2, those who are working at the community level, you remember there was an active case surveillance that was done in the month of April. Those who are working at the community level are not well remunerated. Number 3, today we cannot really say that every health worker already has an insurance cover. So these are things you want to look into and say, yes, is it not a case of maybe we have under budgeted or funds are not being well utilized? So for me, it's out there.
All right, we appreciate your time, Dr. Shalom Moni, public health physician. Thank you so much for joining us on the program. Still to come on the COVID-19 update, hope is the new entry in the race for a vaccine as global infections passes 5 million. We have that story and more when we return. Technology seems to be the answer to the continued closure of schools nationwide. The rector of Kaduna Polytechnic, Professor Idris Bugaji, is advising schools not to wait until there is a directive to reopen them, as they could go ahead with virtual learning. Using Kaduna Polytechnic as an example, he says the school is pioneering online learning at the tertiary level so as to save the nation's education sector.
As soon as the lockdown is relaxed and if students are allowed to come in, we have a number of measures. The Dean of Student Affairs has already worked out, number one, every student must wear a mask. Number two, physical distancing shall be strongly enforced in classes, in lectures, in examinations. Number three, we are going to ensure that washing of hands and cleaning of the environment is done very thoroughly and very religiously. And we are going to ensure that the entire environment is kept safe and clean. We are going to cut down classes. If the class is more than 40 in a small room, we have to split it into 2 streams. We are going to do that. There's no way. And then we have also started this e-learning platform. This e-learning platform is we're already uploading all the lecture notes on the e-learning platform. Students are going to access it, they will study it, so all they need to do is to do review when they come to the class. And this will not be as regular as it used to be before. Secondly, there will be virtual classes. The students can even stay in their hostels or wherever they are, and they will be taking lectures from their lecturer. This is a major one that is coming up very soon. We are hoping immediately after Salah, we are going to launch it, and all students have now registered. Almost all lecturers have also registered, and the platform will start very soon.
And now to ways of curbing COVID-19 across the states. We kick off in Anambra State, where in recognition of the various challenges faced by the physically challenged community as a result of COVID-19, the Anambra State Governor has approved the inauguration of the Disability Community COVID-19 Response Team to evolve their strategy for curbing the spread of the pandemic among members of the community. During the inauguration, the Special Advisor to the Governor on Disability Matters discloses that some of the strategies include having designated or personal care attendants for visually impaired members or those on wheelchairs to enable prompt tracing in any case of infection. And as part of the COVID-19 palliative to low-income earners in Cross River State, the governor, Professor Ben Ayade, inaugurated the anti-tax agency to abolish payment of tax by low-income earners. He said the tax exemption is aimed at encouraging small and medium-scale businesses, farmers, commercial transport operators, food vendors, hotels with less than 50 rooms, and all those struggling to earn a living, to expand and create a livelihood for their families. He frowned at activities of illegal tax consultants who extort money from the poor and vulnerable. Over in Katsina State, the government is seeking an increased collaboration and assistance from various stakeholders to win the fight against the spread of COVID-19 in the state. The appeal is coming as the state government supports the production and distribution of over 1 million free, washable and user-friendly face masks. The Yobe state government has commenced the distribution of food palliatives to the most vulnerable and displaced persons across the state. Governor Maimala Buni, represented by the Executive Secretary, State Emergency Management Agency, says government is fighting 2 battles, that of Boko Haram insurgency and that of COVID-19 pandemic. In the meantime, health workers in Ogun State, southwest Nigeria, have been asked to adopt international best practices in handling and disposing of healthcare waste management to reduce the spread of communicable diseases in communities. The government says it is taking proactive steps towards institutionalizing medical waste management to reduce its impact on residents and the environment. Joining us for more as the new entry in the race for the virus and talking about the vaccine now for COVID-19. In the studio here is Mr. Ayodele Shubowale. He's a pharmacist with the National Orthopedic Hospital, Igbobi, Lagos. Welcome to the program.
I'm happy to be here.
All right. We see that scientists are increasingly optimistic that a vaccine can be produced in record time, as a matter of fact, but getting it manufactured and distributed might pose the biggest challenge. But looking at the role of pharmacists, what role do you think that they play, or what do we know that the Pharmaceutical Society is working on with regards to vaccines or a search for a solution to COVID-19 in Nigeria?
Well, thank you for this question. Let me just say that vaccines are pharmaceuticals, so they fall under the purview of pharmacists. So pharmaceutical companies are involved in the development, of vaccines. These pharmaceutical companies have pharmacists working with them at every stage of the vaccine production. They're involved, right from the from the making of antigens, separation of antigens, formulation of the vaccines themselves. Then when vaccines are eventually given the go-ahead to be put on the market, pharmacists are still involved in post-marketing surveillance. This is done to ascertain the safety of these vaccines. So pharmacists are involved at every stage of the making of vaccines. In Nigeria, we have pharmaceutical companies that are collaborating with their parent companies abroad, so in the formulation of these vaccines. So pharmacists are very much involved. And the PCN, PCN, if you understand, is a body of pharmacists. It represents pharmacists. They are not actually involved, but they facilitate, for companies who want to produce vaccines, they facilitate their making of these vaccines, because they connect them to government. They make government to know their plight. So where they need to be funded, they present their case to government.
All right. We hear that our correspondent Mary Alale Yusuf joins us now. She's reporting from Alausa here in Lagos. Mary, can you tell us what's happening? Status report, seeing as the NMA in the state have reversed their sit-at-home order.
Yes, the NMA, thank you so much, Millicent. The NMA has reversed the sit-at-home order, and they're asking doctors to go back to work at 6 p.m. today. But this is a cautious directive. They're going to be looking, they say, because they said this is not the first time this is happening, and it's really embarrassing. So they will not hesitate to go in there and save, or should I say deliver, any member of their society if anything goes untoward. But for now, the directive has been reversed and doctors are allowed to go back to work. We're expecting the Commissioner for Health any moment now. And of course, there are questions in people's minds with Lagos having 2,954 cases. It's 44% of the burden in Nigeria. That's a whole lot. So we'll be asking them about available bed spaces. We'll want to know the distribution of cases in local government areas as well. And then we'd like to also know about the projection of 120,000 by July. How exactly are we going to handle this progression in Lagos? Millicent?
We appreciate your time. Thank you so much, Mary. We'll try to touch base with you later on in our programs. Finally, to you, pharmacist Shobowale, the use of chloroquine, NAFDAC has said that clinical trials, they've approved that for chloroquine, but what do you make of it and its treatment for COVID-19? Well, I think chloroquine is very relevant in the management of COVID-19. If we look at the pathophysiology of COVID-19, autoimmune is a very prominent feature, whereby the immune system turns on the organs of the body. They destroy organs in the body, especially the lungs. But chloroquine, if we look at the properties of chloroquine, right from in the 40s, chloroquine has been used in the management of autoimmune disorders, lupus, then rheumatoid arthritis, which is an autoimmune condition. So you would say there's promise? Yes, exactly. Chloroquine has a place in the management of COVID. Okay, we'd like to. All right, we'd like to appreciate your time. Definitely, you join us again, talk about this race for vaccines. Mr. Ayodele Shobowale, a pharmacist with the National Orthopedic Hospital in Iwobi, Lagos. Thank you for joining us. Thanks for having me. Now, in a grim milestone, over 5 million people have now been infected with the coronavirus globally. This is according to the Johns Hopkins University. More than 328,000 people have also died of COVID-19, while 1.9 million have recovered. The U.S. remains the worst-hit country with more than 1.5 million cases and 93,000 deaths so far. Take responsibility in protecting your health. The message from NCDC. They say the virus that causes COVID-19 can spread by touching a contaminated surface, so be sure to stay away from them. Their website has loads of updates. Also, the World Health Organization rolling updates on the pandemic. Our website, channelstv.com, has the latest on the stories. Be sure to log on, www.channelstv.com. I'm Millicent Walker. I'm back again at 6. Join us then.